Good evening, everyone. My name is Mireya Piña, and tonight I'll be going over African American women and mental health outcomes. So before I move on, I'd like to briefly go over structurally rooted racism, kind of where it's been and where we're headed. So in 1862, we see here a picture of where there's already slave ownership going on, and this has actually been going on for 200 years prior. Here, 200 years later, we have Black Lives Matter, and we know that's because of the police brutality that's been going on and the micro and macro aggressions towards this group of color and how that's actually reflected on their health outcomes over time. So here we have some statistics. So 13.4% of the American population identifies as African American. And here on the right, we see that 16% of them have reported having a mental illness in the past year, which equates to around 7 million people that have reported a mental health illness. And this is very important because that's a very big percentage. So I'll move on to the next slide. So I'd like for us to just take a quick look at the social determinants of health. So there's these factors that impact health outcomes, and we know depending on how privileged you are, your ethnicity, what you look like, a lot of these things impact the social determinants of health, where you live, what education you've had, what kind of health care can you receive through insurance, and your social and community context, right? And we know over time that the African American community has struggled with racism in social contexts, which doesn't allow for them to feel comfortable in certain spaces. And this actually manifests into worse health outcomes in comparison to groups of other racial and ethnic groups. So here we have health outcomes in African Americans compared to white Americans. And some of these will go over the social determinant factors. So for example, we have like economic stability, so those living in poverty. And we see here in the picture that the red represents African Americans, while the blue represents white non-Hispanic Americans. And if we see all of these 7 graphs, we get to see that African Americans have the higher percentages for unemployment, for poverty, for home ownership, obesity, smoking, and COVID-19. So we see those big health disparities happening, and also those gaps within the social determinants of health. So I'll move on to the next slide. And here we have the leading causes of death for African Americans. Although the heart disease and cancer and stroke have decreased over time, as we can see in the graph, in 2015, heart disease, cancer, and stroke were still the 3 leading causes of death for African Americans. But if we look below here in 2022, we see how that has slightly changed. So heart disease and cancer remain the same, but COVID-19 is one of the top leading causes of death for African Americans. And we know there's vaccination rates that are low among this population. So I'll go on to the next slide. And here we have COVID-19 and how this has impacted mental health outcomes. So 1 in 5 Americans reports experiencing a mental illness in 2020 when there was isolation going on, social distancing, quarantining, and this really took a toll over a lot of Americans. And what it did too was that it increased the health disparities that exist among African Americans, and in particular women as well, along with youth. But for the sake of this presentation, we're going to be focusing on African American women with mental health issues. So here we have mental health among African American women. And unfortunately, only for 50% of women seek mental health support services, and 3% of mental health care providers are of African American descent. So just going back to the first thing I wanted to highlight was that studies reveal that only 50% of women who have a mental health illness seek support. And a lot of it has to do with what's their experience? What has their experience been prior to that? Has it been positive? If it has, that's great. If it hasn't, because of the way they feel with their provider, if they're African American, the patient's African American, and the provider is a white, Hispanic, non-Hispanic white American, then they might not feel that comfortable due to the social history that's happened. So that impacts their experience and also determines whether they are going to go back and seek services in the future. And something very important to highlight as well is that only 3% of mental health healthcare providers are of African American descent. So a lot of these women that are potentially seeking these mental health services, unfortunately, aren't able to. They're in an they're in interracial therapy session, right? So there are those like power dynamics that are sometimes difficult to figure out while you're trying to have a conversation about your mental health. So I'll move on to the next. And here we have cultural patterns. So what I learned was that faith and family play a big role. So for women who might be struggling with the mental health illness, at times they can't give it attention because they are busy being there for their families to the point where they have to disregard their own mental health and their self-care. And faith plays a very big role among African Americans and their community. A lot of people tend to prey on their circumstances and their how they're feeling and their emotions, but sometimes they have to be active about seeking out that support before things turn for the worse. A lot of mental health issues are linked to substance use, as well as maternal issues, specifically for African American women, where we see some of the lowest birth weights and some of the highest infant mortality rates. And there's stigma as well. So there's stigma behind mental health. And then we have the stereotypes. A lot of women don't want to be, African American women don't want to be labeled as angry African American Black women because they're exposed in a different way in the media. So I'll go on to the next. So here, recommended applied cultural health practices. We have the National Standards for Culturally and Linguistic Appropriate Services. And there's 2 e-learning programs that are continuous learning, and they are offered for maternal health care providers and behavioral healthcare providers. So they're able to culturally meet them where they are so they can have more successful outcomes. And with the evidence-based programs for African Americans, the National Alliance on Mental Health has a series of videos that give real life examples of African Americans receiving the services that they need and their culturally appropriate for them. And here we have future directions of mental health. And a lot of what we learned is for services to be culturally appropriate for the communities that they're willing to serve. And there's need around community health education, informing people about mental health so they can have better outcomes and healthier motherhoods, as well as the need for social advocacy so people can have better chances at achieving favorable social determinants of health. And thank you for your time. Below is my works cited.